This is the subsidy letter. When we filled out all the information with your income and immigration status and things of that nature, this is the approval letter that we discussed. This I have sent you by email when we concluded our appointment, and you'll probably get another one in the mail from Healthcare.gov CMS. It will have your name and address here. It'll have the date here. It'll have the application date here again. And this is an important number. There will be a number here which is your application ID. This is the number that we are going to use anytime we're discussing with Healthcare.gov your problems, your case, your file. This is the identifier. It'll have your name on it. And what's going to happen is they're going to list every family member. They're going to list if you have a special enrollment period, if you have an open enrollment period, whatever the case may be here in the results. They're going to give us what you can do. You can choose a health plan. You can make a first month's payment. If you qualify for the silver plans having lower costs, that'll be stated here. Down the page, each family member will have their own subsidy or tax credit amount, but it'll end up being one amount used for your file. This will list the eligible tax credit, what you can get each month, and what the yearly total is. This will have the yearly household income, and this will be the income that we used when we filed for your subsidy. This is the important part. Down here, it's going to say, what should I do next? And it will tell you if you need to send in any proof of income, any proof of citizenship, anything of that nature. This is what it looks like. You will need to send the marketplace proof of your yearly income. You can send one of these documents, okay? Wage and tax statements, pay stubs, and so on. Okay? This is important. If you ignore this step, you will lose your subsidy. They will take it away. And if you have a $1,000 plan and you're getting a $900 subsidy, you will get a bill for that full $1,000 versus your normal $100. There are ways to get it reversed, but you're going to have to go for an appeal, and it is a long, drawn-out process. We need to take care of this, and I can assist you with that. The next page, page 3 or 4, will always have the address. This is where you will send the documents. And when you send the documents, on every page that you send, you will need to put this application ID number. Very important. It's kind of a safety valve to make sure that everything gets loaded into your file. Okay, when you send that in, along with your documents, on page 8 or 9, there is this barcode. This barcode is there for them to scan your documents and attach them directly to your file. Please do not forget to put this page in. On other circumstances, you may be asked to prove your Social Security number or your citizenship, and that will look like this. It will say, what should I do next? And instead of the wage, you may have to send the marketplace proof that you are a citizen. Okay? You will have to, if you are a citizen, you only need to send them one of these. If you're a U.S. citizen or a U.S. national, but you don't have one of these, you will need to send in 2 documents. One from this list, list A, and one from this list, B. So if you don't have anything on the first set, you'll have to send in 2, A and B. Again, they go to the same address, and you will send in that UPC code just as the same. Okay. They also give you a time frame on when you can do it. Down at the bottom of what it's asking for, it will give you a date. That is the date you must have them in by. These steps are very important. We've run into several problems where they've lost them. They haven't been attached to a file. And we've also had it where people just forgot to do it and their subsidy was gone. There isn't much I can do when that happens. This is directly by the government. It is not done by your health insurance company. So if you have a United Healthcare plan, they have nothing to do with this. This is how the government pays your provider. And this is what we need to get that done. If you have any questions, as always, give me a call, send me an email, let me know, and we'll help you through it. Thank you for watching, and you have a great day.